Hello, good evening and welcome to Face Off. I am Nelta Ebe. You wake up in the morning and you're not feeling too well. You seek to get to the hospital to find out what's wrong with you. You seek to see a doctor or talk to a nurse or talk to a pharmacist because you have a prescription you need to have resolved, and all these issues will make one want to think, is it necessary that these people who are so essential to our daily lives, is it necessary or is it important that they should embark on industrial actions at all? Health workers of any class, doctors, pharmacists, nurses, even the cleaners in the hospital, is it necessary that they should embark on industrial actions? We've had incessant strikes, as some will say. Pharmacists, health workers, joint health workers, medical doctors, they're still on strike. They're having a meeting, I understand, currently today at the Nigerian Medical Association. They're having a meeting today hoping to have this resolved once and for all. Well, we heard the Minister of Health tell us yesterday that all the 24 points that they demanded for had been taken care of. Okay, so why is it that they've not called off the strike already? But we're looking at the entire spectrum of the health workers. Should they even go on strikes at all? Is it necessary? Yes, it is said that industrial actions are a tool used by the unions to ensure that their demands are met by the authorities that be. But these people are carrying out essential duties, just like the police or the security operatives. So should the security operatives also go on strike? Well, I'm hoping I'll have this question answered tonight. I have a medical doctor in the studio who will be speaking for the health workers generally, and a human resource manager who will also be talking on the side of the Nigerian who is having to go through all of this. Well, Dr. Adeyelu Olushola, senior resident and medical practitioner. Thank you for coming.
Yes, thank you very much.
All right. On the other side, I have Pt.1, human resource manager. Thank you for coming.
It's my pleasure.
All right, gentlemen, you have 10 seconds each to state your position. Should health workers strike?
Yes. And why? There's like an injunction in the Bible. It said, here cometh the trouble of Israel. And the king, the servant of God replied, I am not the troubler of Israel, you and your household are the troubler of Israel. The analogy is this: as long as we have very palpable, not responsible government, well, the definition of essential will remain a figment of imagination of people that think something is essential when the individual existence is not essential.
Okay.
But the minister has told us specifically that all the requirements NMA came up with has been met in sourcing terms. And that aside, medical practitioner shouldn't come to a point of unionism. Shouldn't degenerate into trade unions and actions and hitting government and more. Nevertheless, the Minister for Health, which I believe is somebody we should listen to when it comes to, he is a voice for health in this country, has said everything you came up with, all the points you brought up to the table, we've resolved. Why do we still have patients dying in our hospitals? Why?
Okay. All right, gentlemen, before you get into it, we'll take a quick break, and when we come back, we'll get down to the get down. Please stay with us, and you can be a part of the conversation. Just join at FaceOff today for those on Twitter, or send us a mail, faceoff@channelstv.com, or you can tweet at Nelta Ebe. We'll be hoping to hear from you. The conversation will continue in a moment. Welcome back. We're asking the question, should health workers go on strike? Considering the fact that what they do, the duties they carry out are considered essential duties, do they have a reason to begin to unionize and even go on industrial actions, and the effect it has on the populace? The recent NMA strike, which is yet to be suspended or called off, has caused a sort of lull in activities in the different hospitals. Some hospitals, I understand, have even been shut down, and many patients have been turned back, even though doctors spoken to off camera will say that they've had to deal with patients that are coming with emergency cases or outpatients quickly and intentionally, even though they're supposed to be on strike. Well, I'm hoping I'll have these questions answered tonight by the doctor in the studio, Dr. Adeyelu Olushola, a senior resident, and Temple Nwoke, who is a human resource manager. The conversation continues now. You can be a part of it via email, faceoff@channelstv.com, or via Twitter @faceofftoday or @NeotaIgbe. Okay, gentlemen, you have a question you want to ask?
Doctor,
Yes.
you see, what is your, okay, let me even hear your point on that. Let me hear what you have to say on that. What the minister told us is not reflected in the hospitals.
Yes.
Because when the minister said to Nigerians, all of their demands have been met, we expected that this issue should be forgotten. It should be an issue of the past. So what is still lingering? What is happening?
Yes, quite understandably. Like to every Lagosian, whether it happens in other places, they will tell you if you wake up very early in the morning, you are going to the east, you are going to the north, and you enter a wrong cab or bus, you enter one chance. You may not have opportunity to return. The minister's statement is synonymous to one chance. Let me show you graphical analogy, and we have a very, very, very unpalatable, not sincere, not assuming responsibility ruling elite in Nigeria. A major general in this country told us he has reunited Chibok children with their parents. This is a physical manifestation. A major general, that is the highest anybody can go. That is mutiny. That is mutiny.
Remember, we're discussing health here.
Yes.
Okay.
Now, why I'm using that analogy is that the Nigerian ruling class is extremely a pathetic one.
Okay.
Extremely decay. So they can, because it's Polonius, one of the great Greek philosophers, he said, words are cheap. Anybody can be excited and say anything, but what does it translate to? I've seen people that, okay, new religious convert, they said, I'm rich in Christ, but the man has no transport fare. The minister has solved the problem, probably in his imagination, probably in his good wisdom, probably in the dreams, but physically, this problem remains unsolved. And the problem with that wrong attitudinal approach will not be resolved. Even assuming all the best wishes, different maneuvers, hardship, everything, the strike is suspended. Has the problem been resolved? No. We'll still come back to this, and I quickly remind people, this is not the first time doctors will be going on strike, and sustainably not responsible a ruling class we have had. In 74, Gowon did the same thing. He was removing roof of professors in UCH, and that was the end where we are today. In 85, they are going to do the same thing that Jonathan and his cohorts are doing now.
President Jonathan.
Yes, President Jonathan did the same thing they are going to do then. Unfortunately, or fortunately, that same hospital where they are going to sacked so many people, he died there. There was no opportunity for the Indian trip then, as people used to go to India and die now. So the real reason is that the minister doesn't use this health system. The family of the president, they go to Germany to assess this their own health care. Which one?
Is this why? Is it because the family of the ruling elite do not use these hospitals? Is that why you health workers keep going on strike?
Essentially,
the question we're asking is, should you be going on strike?
Yes,
should you be striking?
Yes, there are reasons. Why are reasons for strike? The current strikes is touching on the organizational structure of the health system. May I use this simple analogy? You are going to Abuja, you saw an aircraft, and you saw your uncle that you didn't go to aircraft school or pilot school, and he's waving to you, please enter, the journey is going to be smooth. I'm sure nobody will enter. So if the rules the ruling elites are making are to make the health system work, then there will not be basis of anybody's journey to Germany. Now, in this same place, they have created so many rules that the health sector will never work. Number one, people kept saying all sorts of spurious things. Take example, directorship in hospital. Is the hospital system, I use a simple analogy. You enter a courtroom, you see everybody moving every day. Well, it will take you some time to understand it. People always come to hospital, okay, but what happens? Now, in the hospital is different. Everybody is important. Everybody is important, I re-emphasize this. Nobody has decided to be inferior to the other person. We are all aggregation, conglomeration of professionals. But even in heaven, there is a command order. And once this is lost, then there's going to be a problem every day. Now, we have said we are creating directorship. You create a director, deputy director, nursing, and SMO, a senior medical officer, who is not a director, who gives order to the other person. automatically the deputy director of nursing gives order to the SMO, and I'm sure nobody wants to enter that type of bus that will not get to his destination. So now the essential thing is that you can't see American president, you can't see the British president go to America to take treatment or go to Britain. Now, if we domesticate that, look, even the president, Fidel Castro was sick. It required flying a surgeon from Spain to come and treat him in Cuba. But we know the other way here. So it's because nobody assesses our health system, including even the CMDs of our hospitals doesn't use the Nigerian.
Okay, so the man here who is an ordinary Nigerian that uses your hospital.
Yes.
That's my punishment.
Yes.
His punishment is he should suffer because government is
the
not
CMD is not used in the hospital.
Yes.
Especially now that we have a precarious situation of an outbreak.
Yes. Now, no. There's everybody is against collective punishment without selective punishment.
But that's what you health workers are.
Yes, I'm going to explain. Okay. A society that there is state of anomy like Nigeria, that is more afraid of FIFA than afraid of the response of the citizens will get this. Because the issues are clear. Now, like he rightly said, that the minister said he has addressed all these issues. Who is the minister accountable to? Who are bothered about him? What are these issues? Even as simple as elementary as relativity is never resolved. The ad salary adjustment is never paid. Now, we are talking of headship of the hospital, it's never resolved. We are talking of DC mark. What the letter they gave them is that DC mark has been referred to another panel.
Okay, 1 minute, sir.
Yes.
You see, recently there was a conference of African health ministers held in Accra, Ghana.
Yes.
And the resolve of that conference was the establishment of coordinating mechanisms for all ECOWAS countries, plus all Central African countries.
Yes.
On how to ensure, share common strategies and more.
Yes.
Best practices, information as we move on. Now, don't you think this has resolved this matter? Do you think the best way to resolve this matter is to hit the streets? If there is a